Hi, my name is Erica. I'll be your student nurse today. Today I will be inserting an NG tube. So the first thing I would do is I would wash my hands. I would ask the patient to state their name and date of birth. I would double check the order to make sure that it's in for him to get, or her to get, the NG tube inserted. I would do my GI assessment, so I would assess the patient for any nausea, vomiting. I would assess their bowel sounds, if they're passing gas. I would assess if they're having any abdominal pain, any distension, and their girth. I would also inspect their nares, and I would make sure that they are patent, that there is nothing obstructing the airways or any deformities of the nares. And then I would also assess their LOC. The difference between an NG tube and a nasogastric decompression is an NG tube is used for feeding, and the decompression is used for suctioning. I would go ahead and I would place my patient in high Fowler's position. Again, I already washed my hands, so I would just put on my gloves. And then I already did it before, but I would assess the nares. I would have them hyperextend their neck so I can assess the nares more easily. I would use my pen light, of course, to look again for any obstructions or any deformities. And then I would just take a cloth and I would put it over them. Okay, well, the cloth would be up there, but I'll go like that. And then the next thing I would do is I am just going to connect my syringe right away. So after the NG tube is placed, I can aspirate and test for placement and take the pH. And then I'm just going to grab my tape measure. I'm going to measure from the tip of the nose to the earlobe, and then from the earlobe to the bottom of the xiphoid process, which is about 50 centimeters. So then the next thing that I would do is I'm just going to lubricate my tube here. Closer. And then I'm just going to have the patient tilt their head back until the tube reaches about the back of their throat, and then I'm going to have them tuck their chin and tilt their head forward. So, and then if at any time I meet resistance, I can always pull the tube back out and then try again for placement. And then when the tube is there, I'm just going to take my piece of tape that I ripped off. I'm going to just make sure, help keep the tube in place. And then I would also tape it or pin it to the shirt. I forgot to do it in the video, but as I was inserting the tube, if they start to gag or even if they don't gag, I would have a cup of water ready for them, and I would just have them continuously take some sips of water, and that just helps for comfort, and it helps ease the tube down the esophagus. And then once the tube is connected and I have it in place, I would aspirate about 20 to 30 milliliters. And then I would take that off. And then I would put it in a container. I would take a pH strip and I would test the pH. For placement, I can also ask the patient to open up their mouth and examine the tube in the back of the throat to make sure that I can see it, that it's straight and it's not coiled at all. Or I could also call down to X-ray and have an X-ray image taken to check for placement. For documentation wise, I would document the size, the type, how far I had to insert the tube in centimeters, and I would also document how well the patient tolerated it. I would then go ahead and if I were to suction, I would connect this little piece to here, and then I would of course connect it to the suction and have that going. And then I would ensure that the tube is patent. I would then begin the tube feeding as prescribed. I would have documented everything that I explained before. I would take my gloves off, wash my hands, and then that's it. Also, during my assessment of the nares, I would have asked the patient to plug each nostril separately and have them blow out so I'm able to see which one they are able to breathe out of better. And also on the NG tube, the blue pigtail is used for ventilation for suctioning.